first found out about George's diagnosis prenatally, I was devastated. We were all shocked. It was a lot to process and a lot to get educated on it in a quick period of time.
Our son Christopher was born with some issues. They explained to us that every child is born with 2 holes in their heart. One closes at birth and one closes within 24 hours. And the second hole did not close.
I was 5 months pregnant when we were diagnosed. He had a hypoplastic left heart, and it was really tough.
These babies can be sometimes as small as 2 or 3 pounds of weight. The heart is about the size of a ping pong ball, and you need magnifying glasses to see what you need to see.
We immediately began our research and our recommendation process as to where we should deliver this baby. We landed at Columbia University, and it was the best decision of my life.
What I think is remarkable about a busy program is the very individualized care they provide. So it's really not about the number of patients we see, it's about the quality of the experience each parent and each child has when they're seen by our pediatricians and cardiologists. Our patients benefit from the very best resources that we can bring to bear. We have a stellar faculty, cutting-edge research, and a partnership with one of the nation's leading hospitals through our affiliation with New York Presbyterian and the Morgan Stanley Children's Hospital.
We feel extremely comfortable there. The people are super professional. The doctors go out of their way to make us really feel special.
The field of pediatric cardiology has changed over the last couple of decades from being general pediatric cardiology to the subspecialty areas such as arrhythmia, pacemakers, interventional cath, 3-dimensional echocardiography, and magnetic resonance imaging, where we can look at actual function and how the muscle cells are actually contracting. Pulmonary hypertension area, which is world-renowned.
They were at the forefront of this disease, and that they had a specialty there, pulmonary hypertension unit, that specialized in this specific area. So of course that kind of gave us some hope.
As well as our heart failure and transplant division, which is one of the leaders in the volume of transplants that we do.
After seeking the opinion from the cardiology team at Columbia, I was told that heart transplant was indeed the unanimous decision. Surgery went great. She went in pale and cold and came out healthy and pink.
Handing over a 6-month-old baby, not knowing how you were going to get him back, was very difficult. It was the nurses that really helped us through the process. Say he was going to be okay, and there were massages that they had to do to his chest, and they would let us do a little bit of it. So it was very helpful that they did that for us, emotionally anyway.
They will give him all the love they can, and Alan will give him a hug or something. He responds well to them. He's not scared of them or anything. That's what he thinks they are. Maybe part of the family too.
The Division of Cardiology has an incredible track record of training some of the best and brightest pediatric cardiology fellows in the country. We continue that commitment. We continue to attract very talented individuals. These are the young doctors who will go out to other institutions and provide outstanding care. The past 25 years have been remarkable, and we're now transitioning to prepare for the next 25. We've been successful in recruiting 2 outstanding leaders in the field, Emil Basha and Richard Friedman. We look at them as the future.
One of the most important things that we try to accomplish here is to develop cutting-edge research that will really push the boundary between what we're doing now and what we're going to need to be doing in the future. And it's my intention that Columbia be at the forefront of that.
We're all dedicated to having the best possible outcomes, excellent care for our patients, and that's really what matters. So in the end, we're all defined by the patient that we take care of.
She's doing great. She's absolutely thriving. She just turned 1.
I like to play video games and watch movies with my dad.
Christopher's now 21 and a half. He goes to Boston College. He'll be graduating in May.
He's doing great. He's going to school. He's a happy boy. He's doing, all the activities 4-year-old could do.